Let's go back for a second to the early days of the pandemic. Remember that feeling? One day you'd hear one thing, and the very next, something completely different. It felt like getting a straight answer was impossible. So what was going on? Why was clear, reliable information so hard to come by? Well, that's exactly what we're going to dig into, the machinery behind public health communication when everything is on the line.
Turns out, while the entire world was fighting a virus, another war was being waged, a war of information. The World Health Organization even gave it a name, the infodemic. It's this tidal wave of information, some good, some bad, that just completely drowns everything out, making it almost impossible for you to figure out what's real and what's not.
And that really is the central mystery we're going to try to crack. Why was it so difficult to get a clear, consistent message out to the public? To get to the bottom of it, we're going to look at a really interesting study that compared how things were handled in two very different parts of the world, the United States and the Nordic region.
That feeling of frustration we all had, it wasn't just in our heads. It was a shared, global experience. Researchers have now pinpointed three core challenges that fueled this infodemic. So, think of it like a three-part investigation, and we're going to walk through it clue by clue.
All right, let's start with the first piece of the puzzle, the raw material itself. In public health, the raw material is data. Big data, to be specific. But here's the catch. Not all data is created equal. Not by a long shot.
And right off the bat, you can see a massive difference here. In the Nordic countries, they have these incredible national health registries. We're talking population-wide data. Meanwhile, in the US, a lot of the data came from health insurance claims, which immediately leaves out anyone who isn't covered by that specific insurance. It's an incomplete picture from the very start.
And listen to how a director of real-world evidence describes the data they have in the Nordics. Millions of patient lives. That gives you a true bird's-eye view of what's happening across an entire country. It's a much, much clearer signal.
Now, let's flip that coin. A senior analyst in the US said their story of the population's health was told through employee insurance claims. You can see the problem, right? The story has missing chapters before it's even written. It creates biases and huge gaps in understanding.
Okay, so we keep throwing around this term big data. But what does it actually mean? It's not just that there's a lot of it. The experts break it down into what they call the 4 V's.
So you've got volume, which is just the massive size. Velocity, how fast it's all coming at you. Variety, meaning it's not just numbers, but text, images, you name it. But the fourth V, that was the real showstopper during the pandemic, veracity. Veracity is all about accuracy and trustworthiness. And if the data's veracity was in question, the whole process ground to a halt.
Think of it like a recipe. You start with data, raw, unprocessed ingredients. Then you organize those ingredients to create information. From that, you gain knowledge, understanding what it all means. And finally, you get wisdom, the ability to actually use that knowledge effectively. The infodemic is what happens when someone just dumps the raw ingredients on the table and walks away.
Okay, so that's the data problem. But having the data is just step one. Where does it go next? That brings us to challenge number 2, the incredibly complex and high-stakes environment where all this information has to get processed and approved.
Just take a look at this. It's an absolute maze. Before a single press release or public statement can go out, it has to get signed off by all these different groups. You've got lawyers, doctors, regulators, brand teams. The list is huge. And every single one has their own priority, which creates this massive traffic jam of information.
And what all this created was this epic, brutal tug-of-war. On one end of the rope, you have the public, the media, everyone screaming for information right now. That's the need for speed. But on the other end, you have this whole system pulling for absolute certainty, for legal and medical perfection. That's the demand for accuracy. And they were constantly at odds.
And that regulatory maze wasn't the same everywhere. In the Nordic countries, it was like trying to send a message in 5 different languages. Each country had its own unique, strict rules, which caused huge delays. In the US, the rules are more consistent across the country, but the sheer number of stakeholders created its own kind of bottleneck.
So, we've got the data problem and the environment problem. That brings us to the final and maybe the trickiest piece of our puzzle, the message itself. The actual craft of communicating this stuff to real people.
You know, this is such a critical point. One of the biggest challenges wasn't just sharing good, clean data. It was figuring out how to talk about bad data. Data that was messy, incomplete, or uncertain. I mean, think about it. How do you tell a terrified public, we don't know for sure yet,
without them hearing, they're hiding something from us.
And that's the heart of it, right? It was this constant tightrope walk. You have to take this incredibly complicated science and translate it for everyone. But if you simplify it too much, it's not just simple anymore, it's wrong. And in a pandemic, being wrong has massive consequences. The pressure was unbelievable.
Okay, so it all sounds pretty daunting, I know. But here's the good news. Laying out all the problems is the first step toward finding solutions. And this research didn't just stop at what went wrong. It gave us a blueprint, a path forward for how we can do better next time. First things first, empower the people crafting the message. This means giving communicators the training they need to actually understand the science. It's pretty simple, really. You wouldn't ask someone who doesn't speak a language to translate it, right? We need to bridge that gap between the scientists and the communication teams. Strategy number 2 is all about the power of story. Because let's be honest, a page full of statistics isn't going to resonate with most people. But a story connects. This is about coaching the experts to find the human narrative, that gem of a story hidden inside all the numbers. Facts are forgotten, but stories stick. I just love this quote from a communications leader. It just nails it. They're telling scientists, look, I'm not asking you to stop being a scientist. I'm asking you to let us put your essential science inside a story so people will actually hear it. And finally, the third strategy. This is the big one. Go upstream and fix the broken system. Use the data to show policymakers exactly where the bottlenecks are. The goal is to streamline those regulatory mazes to build a faster, smarter, more unified system. Because this isn't a matter of if there's a next crisis, but when. So, that's the roadmap. But it leaves us with this huge, lingering question. In a world where a rumor can cross the globe in seconds, is it even possible to have a pandemic without an infodemic anymore? Or are they now and forever two sides of the very same coin?